Some experts have called Delta the most troubling variant by far due to its high transmissibility. According to the World Health Organization, the strain is about 60% more transmissible than B.1.1.7, the UK variant that was recently renamed Alpha, which was the dominant strain of new cases in the United States until about a month ago. The Delta variant first surged across India in March and April 2021, and pushed the country's COVID-19 death toll past 400,000, according to the Indian government. But researchers from Brown, Harvard, and the Center for Global Development believe the number is much higher, up to 5 million deaths. In the United States, in just 3 weeks Delta progressed to dominance and now makes up approximately 83% of new cases in the country. Patel said this is just an estimate, and experts believe that number may be higher due to Delta's ability to replicate faster. We now have mounting evidence that the Delta strain itself reproduces in people's nasal passages, mouth, and body faster, up to 1,200 times higher than previous coronavirus strains, she told Yahoo News. This knowledge comes from a recent preprint study from China where scientists examined 62 cases of the Delta variant and found viral loads about 1,260 times higher than those found in 63 cases from when the virus was first detected in 2020. Based on this research, Delta also appears to be more infectious earlier in the course of illness, with an average of about 4 days for it to reach detectable levels inside a person, compared with 6 days for the original coronavirus variant. Although Delta appears to be more contagious than other variants, it does not appear to be more severe. One recent study from Scotland suggests the Delta variant is about twice as likely as Alpha to result in hospitalization in unvaccinated individuals, but other data has shown no significant difference. Patel said research is ongoing to determine whether the strain leads to higher than expected deaths or hospitalizations. Unvaccinated people are at risk. Dr. Rochelle Walensky, director of the Centers for Disease Control and Prevention, said at a COVID-19 briefing on Friday that this is becoming a pandemic of the unvaccinated. Walensky said that more than 97% of people hospitalized with COVID-19 today are unvaccinated. Dr. Vivek Murthy, the Surgeon General, said on Sunday that 99.5% of Americans who are dying are those who didn't get the jab. Patel said some of the symptoms being reported are classic COVID-19 symptoms, such as loss of smell, loss of taste, fever, and a cough. However, Patel, who is a primary care physician, said doctors are also seeing symptoms they would normally see in a common cold and allergies, such as runny nose, headaches, sore throat, and itchy eyes. Sometimes people think that they are allergies, and in many cases they might be, but they're not necessarily those classic symptoms of a fever and loss of smell or taste. So I'm encouraging anybody who has had symptoms of any kind that they do not normally experience, that they should go to a doctor or somewhere where they can get a rapid test to find out within minutes if they might have COVID, Patel said. Those who are vaccinated might still catch Delta, but there's no reason to panic, because most people who do will experience fewer symptoms with less severity. There have been a number of recent reports of fully vaccinated people testing positive for COVID-19. However, these breakthrough cases do not surprise or alarm doctors since they're not occurring at concerning levels and the vaccines available continue to hold up well against the Delta variant. If you are vaccinated, remember you are safe from death and hospitalization, said Patel. What we don't have data on is whether you get vaccinated, get a breakthrough infection, maybe have no symptoms, but you might pass it to someone who's unvaccinated. We are waiting to kind of have the clinical data to confirm if that might be the case. Which is why we are telling everyone if you've got unvaccinated people in your household, then you should make sure you take precautions, she added. Bottom line, vaccines continue to be the strongest weapon against the virus. The most important thing you can do to protect yourself and loved ones from Delta is to get fully vaccinated, doctors say. That means 2 doses of the mRNA vaccines such as Moderna or Pfizer-BioNTech, or 1 dose of the Johnson & Johnson vaccine. All of the vaccine manufacturers have conducted studies to assess whether their shots are still effective against the Delta variant, and they are. Although in these analyses a small drop in potency compared with the vaccine's effectiveness against the original strain of the virus has been observed, especially in the Johnson & Johnson shot, all 3 still offer substantial protection against the virus. A Public Health England analysis showed that the Pfizer-BioNTech vaccine, for example, is 88% effective against symptomatic disease and 96% effective against hospitalization from Delta. Children under age 12 are not yet eligible for any COVID-19 vaccine. Emergency use authorization of these shots for children may not come until midwinter, an FDA official said recently. Patel said the best thing you can do is create a line of defense for your children by getting vaccinated yourself. Additionally, she recommends treating them as if they are extremely vulnerable to getting infected and avoiding congested areas, especially indoor spaces. Choose outdoor spaces, and other places, with great air ventilation, and then the quality of your masks matter for kids. You really want to try to just protect and cover their nose and mouth as efficiently as possible, Patel said, until there are widespread pediatric vaccinations. These tips will be important to keep children safe, especially going into the school year this fall. It is why, Patel said, the American Academy of Pediatrics made a very bold statement that any child over the age of 2, even those who are immunized over the age of 12, should be wearing a mask in school this fall.